another episode or another live session of Let's Go Live. I'm just gonna get some stuff together and kind of wait until our guest gets in the room and just wait until everybody else join. But basically, just for our introduction, this live session will be talking about prevention of NCDs or chronic illnesses with self-care measures. So how can you do self-care activities and so on, and then lower your chances of developing NCDs. So hold on. Oh, I see some people joining. Hi, Camille. Hey, Jay. Hey, Drew. All right. I'm just gonna get some stuff together and wait until the guest comes in. Who preventing NCDs? Hi, Isha. Pin comment. All right, we've I don't know. What's everybody doing, by the way? While we wait, everybody just drop. Who is in here? Just drop some comments. Say hi. Do whatever. All right, there's our guest. Oh God, thank God. Oh, that was so awkward. Hold on, let me see if I can add her. How this work again? Yo, I haven't done this in a little while. Good Morgan, Kelly-Lois Gooden Morgan. I just invited her, so she's gonna accept
Oh, I'm so
it.
excited.
So she there. All right, wait. Yeah, wait, sir.
Hi.
Hi, what's up? You all right?
Yes. Let me get my AirPods in.
Okay, good. Regina, hi.
There we go.
There you go. You can't hear me?
I
Well,
can. Can you hear me?
I can hear you well and everything.
I don't know.
All right, great. One more time, just for the new people that join. Basically, this session is going to be talking about prevention of non-communicable diseases, or NCDs for short, or chronic illnesses with self-care measures. So what can you do with self-care by yourself to prevent your chances or lower your risk of getting NCDs slash chronic illnesses? Our guest for this session is Dr. Kelly-Lois Gooden Morgan. So, Doctor, please introduce yourself for the audience.
Okay. I am Dr. Kelly-Lois Gooden Morgan. Thank you so much for having me. I'm so excited to have this conversation with you.
Of course.
Yeah, I'm
right.
a big fan of yours. Yeah, so I do general practice. So I'm an actual doctor. People always ask that question because I do so many things. I am an actual doctor. I did get a bachelor's in medicine and surgery. And sometimes I do alternative, which is like more holistic medicine. Thank you. Somebody said my skin is skinny. I know. I didn't even get to do my makeup, but I'm glad y'all see the skin.
So
okay.
My skin.
Yeah. No, it always is too, because you do your self-care. Okay. Yes.
Exactly. Thank you.
So I do a lot of stuff. I also do energy healing. So I do a lot. Hi, Bestie Bear.
Hold on. I think the Wi-Fi just kicked. Oh, can you hear me?
Yeah.
Yeah. You can hear me now? Okay.
And I just kind of made sure that mine was good too. Like, man, is it hot? Oh, child.
What is it? Over here is.
It's hot over here.
I would love to be hot right now. I can't.
I know. I can't send you the sun.
Oh gosh. Yeah. All right. Well, thank you for your brief introduction. And yeah, so guys, she's well equipped to talk about just holistic activities and self-care activities that you can do to reduce your risk for NCDs. So now, speaking of self-care, Dr. Good Morgan, what does the word self-care mean to you? When you hear somebody say self-care, I'm doing self-care, what does that mean to you? Or what is that definition you want to give the people?
Yeah, right? It's a good question. Yeah. So, because we have that word tossed around a lot, that is just a thing that people, it's like a, what's the word? Like a catch-all phrase right now. By the way, if you see me looking down, I have notes written down because there's just so much to say on this topic. But generally, so like the internet might define self-care as the practice of taking action to preserve and improve your own health, right?
Yeah.
So it also includes the ability to care for yourself through awareness, self-control, and self-reliance. Now, the reason it's such a good catch-all phrase is because I think it's so all-encompassing, because self-care can be anything from remembering to eat, remembering to exercise, to journaling, to going to therapy, to also seeking professional help if it is necessary. Okay.
Yeah.
So all of that involves self-care, self-awareness. So it can be from the micro level of realizing when you're feeling angry, sad, or something has shifted, to something really big, like I have this massive thing on my arm. I need to go get it checked out. I need surgery. I need whatever it is that I need to do. I need to take my medication for whatever it is that's going on, if it's necessary. And I'm going to talk to the right healthcare professionals that can help me navigate that space, no matter what it is. So I think that self-care, all of that is self-care.
Yeah, I'm glad that you mentioned that too, that seeking out help and going to the doctor and the right health professionals is a form of self-care. Because for me personally, I try to preach that so much, going to the doctor is a form of self-care. Because when people hear self-care, they hear self, and that's it. So it's like everything is by myself, is just me. That's all I have to do. I have to go find some herb. I have to go to the supermarket, go find something. My arm hurting. What can I do for the arm personally? They're not thinking about, I have to see the doctor. That's a form of self-care. Or I need to get proper care. I need to even get medication, maybe. Like, that is a form of care. Or taking your medication on time. You have proper medication.
Absolutely, yeah.
Pharmaceutical medication, on time. That's a form of self-care as well. So it's more, for me, the word self-care, as you say, is a catch-all. So it can encompass that, glitz and glamour of, I'm going to the spa, or let me put on a mask today, bathrobe, this and that, that glitz and glam type of thing. But it also has that aspect of it where it's like, I need to do my daily checkups not daily. I need to do my yearly checkups, or my regular checkups at the GP, at the doctor, at the dentist. I need to be reading my blood glucose levels if I'm pre-diabetic, to make sure I'm not going into diabetes. I need to be eating right, make sure that I'm not pushing myself into hypertension, and to be exercising to make sure that, everything right, everything sorted out. So that's what self-care means to me, and I'm glad that you agree. It's more of like a holistic thing that does even take into consideration liaising with healthcare professionals as well. But really good that you said that. I'm glad someone asked the question, because it's in line with the outline. But someone was asking, what is NCDs? I think basically they didn't understand what the acronym meant. But also, I was also going to ask you, what are chronic illnesses, basically?
Yeah. All right. So let's go. NCDs, non-communicable diseases. All that means is you can't catch it. Can't catch it like that, like from one another, right? It's non-communicable. So I can't communicate that to you. I can't touch
non-catch,
disease. Non-catching disease.
Non-catch disease.
Right? That sounds good. That sounds like that makes sense to me. All right. But let's talk about actual chronic illnesses. So like I said, I wrote some stuff down, guys. So if you see me looking down. So when we're talking about like the medical definition of chronic illnesses or chronic diseases, it's any condition that lasts 1 year or more that requires ongoing medical attention, or that limits your health for that persistent period of time, or limits your daily activities, right? So you can talk about asthma, hypertension, diabetes, cancer, heart disease, and the list goes on, right? These are actually the highest. So if you're looking at your likelihood between dying from something like this to something like a car accident, a lot of us take a lot of precautions, in terms of our cars, making sure we're safe, making sure our homes are locked up. But you're more likely to die from one of these illnesses than a random freak accident. So that's why these things are so important, because many of us are, well, not many of us, all of us are at risk of getting one of these illnesses, right? Now, before I move forward, I want to say that I know that that's the general definition. However, when you're talking about me as a holistic practitioner that's taking into account just about everything under the sun that you could imagine, like I am viewing a patient from all angles. When I talk about a chronic illness or a disease, I'm talking about dis-ease, the body having an uneasiness, which means an imbalance within the body. So whether that's the fact that like a little stress is good for the body to keep functioning, but when you have too much stress in your life, too much salt in the diet, too much sugar in the diet, not enough exercise, not enough time spent regulating your emotions, not enough time sleeping, all of these things can cause a dysregulation, a dis-ease, an uneasiness within your body that creates that constant state of flux, that creates a constant state of disruption in your regular body performing its usual tasks. So it's even simpler than we think sometimes. Yeah.
Yeah. Okay. Thanks so much for that definition, and thanks for bringing up the fact that you're more likely to die from a chronic illness from like a freak accident, because actually it's about, I figure, like 74% of global deaths annually is attributed to chronic illnesses, which is just the majority of deaths. And then in that as well, the majority of NCD related deaths are cardiovascular issues, even more than cancer, which I found crazy, because like cardiovascular, it's just so much more, and correct me if I'm wrong, so much more preventable, or like
No, you're not wrong.
measures that you can do cardiovascular issues than cancers, because cancer is like, why, no matter what you do, sometimes sadly, you get that.
I know.
Like, cardiovascular issues more than cancer. Exactly.
Yeah. And it's funny because there are some cancers that people get, and even though they have the cancer, they're more likely to die still from a cardiovascular illness or something like that than the actual cancer.
Really?
So absolutely. So sometimes people will come to us as doctors, and what we kind of want to say is, I know that you're worried about this, but you need to be watching your blood pressure. Like, we're more concerned right now, depending on the cancer, about this blood pressure, about this diabetes, like this sugar level, like what is going on here? Okay, you're not eating any good food, like, like that's of concern sometimes more. Yeah.
That is what I didn't even know that. I didn't even know that insight. Quite fair. And speaking of insight, let's move to the next question. A great segue to the next question. What are some of the more common NCDs that you see in your practice?
Sure. So this is gonna be really interesting, especially to the men. I hope there are men on this live, and I hope they're listening. Right? Okay. So of course, I work at multiple practices. So one of the practices I work at, even though it's a holistic or alternative medicine office, generally, I work with my consultant who is a hem-oncologist. So we see a lot of blood disorders and cancers, right? And so one of the things that we notice in that practice, I'm gonna show you, like, it's funny. We're seeing a lot of more rare and like the strangest cancers that are popping up all over the body that are supposed to be like 1 in 5 million. Like, we're seeing so many. The next thing that we're seeing a lot of is erectile dysfunction. Now, this is funny because I'm seeing this in the alternative space as well as the more traditional space. So in those settings as well, I'm getting a lot of young men, 20s, 30s, like hot, coming in going, doc, I cannot get it up. I can't maintain my erection. I can't continue. It's not working. But that's not their only issue. They're also not sleeping. They're also not eating, right? So we also see a lot of diabetes, hypertension. That is not surprising for our population that is mainly a Black ethnicity, right? That we do have higher proportions of those things in our like Black population. However, it's the age at which I'm seeing it that's alarming to me personally. You're seeing a lot of 20-something, 30-something year olds coming in with pre-hypertensive like values, with pre-diabetic values, people who have like arthritis as well, they're having a lot of joint pain, they're having a lot of back pain, and they're having a lot of, like I said, erectile dysfunction with the men, right? So that is all very concerning, because those are things that are indicators of the population's health. The worst thing that I am seeing, which is interesting, all parents listen up, is the fact that the children, when I do school medicals, a lot of the children, their eyesight is not good.
Oh.
Like usually, and I've seen this as, you know, being a medical professional for years now, you know, we're used to doing school medicals every year, because every year, you know, children need to do it. Normally, every child, most children will be 20/20. You might have one or two who need glasses. Now it's the reverse. A lot of children are seeing not well at all, and I have to be sending them to the ophthalmologist. It's really concerning to me. It means that we're not doing a good job as a nation in terms of regulating the food, the exercise, the diets that we have our children on, as well as the screen time.
Yeah.
Where I think we need a lot of help with that.
That definitely sounds like a screen time and bedtime type of thing too. Yeah.
Yeah.
Definitely agree.
Both. It's both, yeah.
Back to the point of you saying that there's like an increase in these random cancers happening. I'm not sure if you were at that MDS conference about was it rectal cancer or colorectal cancer? Yes. So basically his talk was saying that there was an uptick in colorectal cancer in younger population. Do you find that in the practice?
Absolutely. That is such a big thing. A lot no. And then hear this, get this.
Yeah.
It's not just colorectal cancer, it is colon diseases in general.
Oh.
And as you know, I wrote a book.
Yeah.
Shameless plug. IBS 911, of course, that's my book. It's on Amazon.
It's on Amazon.
It's on Amazon.
Is it in the link?
It's in my bio. Okay. The link is in my bio.
Keep an eye on Amazon, everybody. Yeah.
Right. But the point is that the reason I wrote it is because there is such a huge increase, not just for me, but like for so many people with irritable bowel syndrome and general gut disorders. This stems from two different things, from multiple things. But the food that we're eating now has become so devoid of nutrients and so devoid of fiber, a lot of it, because it's not organic, it's not whole foods that we're eating in majority of us. And it's taking away the bowel's ability to self-clean, right? But and not just that, higher increase of the processed foods, but we're talking about stress. A lot of us are taking on more and more stress. It is becoming more regular to constantly multitask, to constantly be asked to do more and more and more.
Yeah. And
that then contributes to a vagus nerve issue. The vagus nerve is a nerve that comes from the brainstem, right? And it goes all the way down. Now it connects to your heart, it connects to your lungs, it connects to your gut as well. And people don't realize that when you have stress going on here, you're going to have stress going on here. And it's going to affect it significantly. So in fact, I personally had irritable bowel syndrome for like more than a decade, for a lot of my life. And that, I believe, formed a mass in my colon. It became so large that I actually had to have hemicolectomy, which is like I had to remove half of my colon in order to remove it, because they were worried that it was cancer. And I'm only 33 now, right?
Yeah.
So in like as a 30-year-old with a massive colon mass that like shot up almost overnight, you could imagine that everyone was extremely confused. Now, when they took it out, they found that it was like only inflammatory tissue, which was due to the stress, which was due to the inflammation of not eating the right things, but also constantly being worried and stressed out. But the truth is that even though it was just an inflammatory mass, that definitely would have become cancer if it was left there. So if I did not get my regular checkups and screenings, okay, that is the thing that we're telling you. If I didn't get tested, like I got checked out by a doctor. One of my friends, I went to her and she said, Kelly, honestly, I want to examine you. I feel like we need to be thorough about this. And she examined me, and that's the only reason that could have saved my life, because it definitely would have formed into cancer. So this is why we're telling you that it's important to get yourself checked out. Don't always think that you can do things by yourself, you know, because that's what we're here for, to be a team, to
Yeah.
work together.
Yeah.
Yeah.
I'm so glad you said that, because I was even gonna
Yeah.
ask if that's one of the reasons you think that there's an uptick in I guess colorectal issues, where it's like, and a lot of it, I think the doctor was saying, the presenter was saying that a lot of it is in men too. So I was about to ask you if you think a lot of that uptick is coming from just that male thing of not wanting to get it checked out, or just like,
Yeah.
I'm all right, you know, or oh, it's just like a belly pain, or oh, I'm just going to the bathroom, and you know,
Yes.
I was
Yeah.
definitely gonna ask that, but
No,
yeah, as you can see,
it's
if
twofold.
yeah,
Yeah. So I'll
so it's
I'll
that
say
and the
too.
increase in just
Yeah.
the crap food nowadays.
No, yeah, but then also for men, and I want to talk about that because we don't talk about men
Yeah,
enough. I think genuinely in this space, we think self-care is for women, like it's a woman thing. It's not true. That's not true. That's not the truth, guys. What I find is that it's all tying together. So not only do men not get regularly checked up as much and ignore certain painful symptoms or uncomfortable symptoms, where as a woman would get checked out, but men are not receiving the same outlets that women do in order to process their emotions. And so it's not just showing up in that increase in colorectal cancer, even though it is, it's also showing up in an increase in anxiety in men, depression, an
stress.
increase in erectile dysfunction, which comes a lot from, because when we check these men out, they're healthy in terms of their physical body, they're healthy. But when you check it out, they're not sleeping. They are constantly stressed and worried about certain things in their lives. And they have no way, like they're not being taught like how to figure out how to navigate that space at all. And so you have a conglomerate of diseases that are coming up, especially for men in younger and younger ages, because they're not receiving the care that they need. They're just
Yeah,
not.
yeah, and it's
Yeah.
such that thing. It's a very annoying cycle of, you know, as I can tell you, it's
Yeah.
annoying, where like people are like, oh, you need to go and get checked at your doctor, you need to do this, you need to do that. But at the same time, you're pushing the rhetoric of, oh, you need to be a man, stop ball about this, stop crying
Yes.
about that, you know,
Oh my
just
God.
deal with it like a man. So it's like, it's
Mm-hmm.
just this cycle that society just perpetuates.
Yes.
And it honestly, it definitely warrants its own even live session. It warrants its own
Yeah, that's so good.
conversation.
That's so point. Yeah.
That's a thing. So I might even come back to you and then we have a little part two or something like that, to be quite
Yeah.
fair.
Yeah, that'd be good.
Seeing a comment. Hold on. Interesting that the diversity in men and women care is based on society and lifestyle practices. Interesting. I mean, to tell my husband about that. Yeah. About this point, interesting that the diversity in men and women care is based on society and lifestyle practices. I mean, basically, already you have agreed with it, but what's the extent that you agree to that comment?
Hmm. Listen. Listen. Where do you start? Where do you start? Because I mean, you want to talk about the fact that like when we have breast cancer month, breast cancer is like this huge thing, and we talk about, oh, and like women need to get their breast checks, and everybody loves breasts. Woo, breasts.
Yeah.
When colorectal cancer month comes about, right? When colon cancer month comes about, why nobody don't love them bottom?
No,
Like
nobody know what to.
nobody loves prostates. I don't talk about prostate cancer. I'm like, nobody loves prostate.
No one wants to
Like
talk about it.
nobody wants to talk
Yeah,
about that. Like that's not glamorous. That's not cute. That's not like
yeah.
guys.
It's associated with
Yeah,
that obvious Jamaican
it's that
thing.
thing. We
That
tell
negative obsession with that area. You know,
hmm
it's yeah, yeah.
yeah,
Which
and we tell women all the time, get your pap smear done, get your pap smear. I don't even like. There are certain things I wouldn't even start like the conversation about because that's such a big
yeah,
topic on its
yeah.
own. Because when I tell you that I have a love-hate relationship with, and I'm gonna tell you what um sorry, what it is. What is it? There is, sorry, I just read a comment. Somebody asked, what is a colonoscopy? So a colonoscopy is basically looking into the bottom and then going into the rectum, the colon, the gut system, the lower gut system, using a camera, like use a scope.
Yep.
So colon scope. So you scope the colon. That's really what it is. But we have an issue where you have the vaccine, the cervical cancer vaccine that's being given, that rolled out to be given to young girls in schools. Now, that is an issue to me because they're making it seem as if, yes, young girls have cervix, like we're the ones with the cervix, cervixes, whatever. However, men are also carriers of human papillomavirus and are also at risk of getting penile cancer from the human papillomavirus. They're also at risk of getting, but also giving that HPV virus into the oropharyngeal area, into the mouth, which is now causing an increase in throat cancer. I know we've seen the headlines. Throat cancer is on the rise. And do you think it's only women giving out that HPV? Absolutely not. Yeah. We also don't have a culture of circumcising our boys, which helps to decrease the incidence of transmitting that virus from men, by the way. So circumcision is actually very helpful in decreasing the rate in societies where they circumcise all boys, all men. You have such a lower incidence of cervical cancer. That's something that, did y'all know that? Right, cervical cancer is such a huge thing, but yet we're targeting women and saying, oh, women, you fix it. The boys don't need to worry about it. But that's not true. It's just not true. And this is
that's
how
such a deeper issue too. Like there's so many things where women, like, let me tell you what's happening. Women are the issue. Women need to be fixed. You're giving all the solutions to women, but at the same time, you're not addressing the guy side of it. And so that is just being perpetuated. That's just being allowed to go on. And then it's like the disease. And we're just talking about physical, not even going into the psychosocial part. The physical issue is still going on and perpetuating. As I said, they're still having the HPV. They're still transmitting the HPV. They're still getting their cancer. They're still doing this. They're still doing that. You know, they're still the ones that causing the pregnancies, you know, where people bawling for abortion and so on, while they're just not talking about anything.
Exactly.
it's
so the thing is,
issue.
Right. The thing is, patriarchy. People want to talk about patriarchy affecting women. Patriarchy doesn't just affect women. Patriarchy is a systemic issue that affects men and women because we are putting all of the onus and responsibility on women to self-care and take care of and heal and fix and da. Now you're getting men who are completely left out of the picture, completely left to like wander off on their own, and they're not getting the care and the help that they deserve and need. So definitely an issue.
All right, so I'm going to finish. I'm going to go through the outline of our schedule basically. And please drop your questions down in the comments as you're and then we're going to come back through later on because they're really, really good points that we really want to touch on. So thank you for them. Drop them down. We're going to finish up the schedule. I'm going to go through them again and give a question and time. So what I want to ask you know is, how do you think self-care can play a part in chronic illness prevention?
Oh, okay. So let's get back to my notes.
Yeah.
Okay. So it absolutely plays a huge part because again, we're talking about looking from the food that we eat, okay, to being, you know, all the things about like your mental well-being, your state of well-being. Now there's so much. This is such a huge, broad topic. I'm gonna just give you some headlines. Okay, let's talk about food. Eat things that are not in packages. Okay, eat things that are not in packages. Try and stick to whole foods. People always ask me, what diet is the best diet? There is no diet that's the best diet. And if anybody is telling you otherwise, it's a lie. It's not true. They're selling you a scam, okay?
Yeah.
It's not vegetarian. It's not this. It's not that. It's not meat. It's not da. There's no diet that's right, that's perfect for everyone. But what I can promise you is that if you stick to mostly whole foods, which are things that are close to the ground, things that come from the earth, from trees, from that God made. So if God made it in its natural state and that's how you're eating it, that's like the best thing, or like closest to that. Anything in a package that lasts for months is probably not as good for you. Simple, easy. So try and make sure that 80% of your diet is not coming from a package or coming from a fast food restaurant. It's not
That's
coming
so
from that.
just
Yeah.
real quick too. I just wanted to add a
Mm-hmm.
point that I think there was a thing happening it was either TikTok or in the news where like this lady just had a McDonald's burger and she just left it for like a year or like 2 years
No, yeah.
and nothing happened to it. And I'm like,
Nothing has happened to it.
if
Yeah.
the microbes or the bacteria or the fungus don't want to eat it, I don't think we should be eating it, because
We should be
basically
eating it.
half of our digestion are microbes, half of our digestive system are microbes. So if they don't want to eat them on the outside, what's
On the
happening
inside,
when you go inside,
no
you know? Yeah,
nutrients.
exactly. So
None.
continue your
None.
point. I just wanted to
Yeah,
add
no,
that.
absolutely. You need energetic, like energetic foods. You need high energy foods in order to have high energy. Does that make sense? So if you're eating dead foods, you will feel like you're dead. You will wake up groggy, feeling nasty, whatever, whatever. So we want to talk about exercise. Of course, 30 minutes of exercise 3 times per week at least is the best thing, right? And that can be any form of exercise that gets your heart going. So these are just like general stuff, yeah, we need living foods, you want to talk about journaling and all of those things you can see on our pages. We want to talk about meditation. You want to talk about yoga. There are so many studies that show that doing things like meditation, and not just that, but mindfulness, which is just sitting, looking at the trees, looking, like paying attention to what it is that you're doing in the moment. That's mindfulness too. All of those things actually have marked like effect on decreasing your HbA1c, your blood sugar levels, stabilizing your blood sugar levels, stabilizing your pressure, stabilizing your, and like reducing anxiety and stabilizing your mental health, as well as helping to, stabilize things like asthma, like, preventing asthmatic attacks. There is a gamut of research that has been done to prove that if you are doing things that, breathing exercises, like that is gonna help. And if you go on your page, if you go on my page, you will see a lot of different ways to get that help that you need. So I'm not even going to talk about that, but I will say right now, there's a little jingle that I created that I want you guys to write down. So I'm going to ask you to grab your pens, grab your paper, grab your phone, flip out the notes app. Well, not if you're watching this on the phone, like don't do that then, but like grab a paper, grab a pen, because there's a little jingle that I
I
want
can
you
actually
to do.
get my laptop up too.
Yeah, please. Because
So I
I
can
think
get it done as well.
the most important thing is, let's start at the very beginning. Let us make this as easy as possible for all of ourselves to move into a direction of better self-care and better health, right? And that starts with awareness. Thank you. Using your laptop. Great. All right, if y'all ready. So the jingle is, have I had something to eat? Have I had something to drink? Can I name something I feel? And can I name something I think? Right? So it's just 4 things. And I'm going to repeat it. I want you guys to take a note of that throughout your day. So if you can put it in your timer to just notify yourself, because if you're able to bring your awareness to these things, then you can start the journey of healing and self-care, because those are the ways that you're going to say, hold on, my tummy hurting me. Why is my stomach hurting? You know what I mean? My chest feels tight. Why is my chest tight? And then you realize you're thinking about a deadline that you have, and you're like, I'm stressed out. Like bars, right, girl, bars. I'm telling you, So let me repeat that, okay? Have I had something to eat? Have I had something to drink? Can I name something I feel? And can I name something I think?
Okay.
Right? So when I'm talking about eating, a lot of us don't eat until like 3 p.m. Yeah, I'm looking at y'all, okay? If you feel like I'm looking
You're
at
looking
you,
at
then I'm looking
me.
at you.
Oh.
right? I'm looking at everybody, right? People come to my office and they're like, oh, my stomach hurts and I feel so sick all the time. And I'm like, okay, so like, what do you eat for breakfast? And they're like, breakfast. And I'm like, all right, what do you eat for lunch? And they're like, lunch. And then you're like, okay, so what do you eat for dinner? And they're like, oh, McDonald's. And I just want to get up and be like, well, go outside, go eat some fruits, and come back and tell me how you feel. Yeah, no, my friend is saying, okay, kettle I see. Nah, because I'm talking to myself.
Yeah, no.
I'm talking to myself.
Most of it, when we see each other, we see each other.
I know. No, it's a thing. Okay. So, why do you think I know so much? Because
no,
like
it's like even for people like us too, like we're in the space and we are trying to preach that it does happen. Sometimes it happens, you know, you wake up and it's like from morning till dusk, especially for you in healthcare, from morning, you have to rush go to practice and then just turn out a late one that day and it's just you haven't eaten until a
all day.
time. So you
not even just eat, but drink. Our bodies need like so much water, so much, even not just water. But oh, thank you. Somebody put it in the comments, and I love that. Thank you. Yeah, that's great. Thank you. So
some for Regina because she has been
right. She's the moderator of the group. She be the mod. She be the mod. Yeah. But yeah, no, because like even with water, people are like, I don't need to drink a lot of water. People have like a cup of water a day. At my weight, I weigh about 120 pounds. That's my heaviest. I'm supposed to be drinking 3 liters of water per day. Per day. That's one huge bottle of water. Like, you know, those like
I wish I could. I left mine
that's
at
two of them, right? Mine is somewhere over there. But it's massive.
It's massive.
And that's 2 of them I'm supposed to be drinking. 2 of them. Right? No, and so a lot of people don't like drinking water. Drink structured water. Now, let me explain that, right? Juice fruits that have a lot of water. Juice your cucumbers, juice your watermelon, have those juices. Have fruit juices. Don't put sugar in there. Just blend it out or juice it and drink that. That's also structured water. That counts as water. That's fine.
Yeah.
I mean, I'd love
if
you drink a little regular water.
I just want to interject really quick. Sorry. But
go ahead.
Hydration hacking, actually, I think it's a thing that's happening on TikTok too, where it's like just buy as much hydration, ways to drink water as possible. For basically for people who don't really like drinking water that much. Me myself, give me water all the day. But if you don't like drinking water, hydration hacking is a way that you can get a bit more water in. Yeah. As Doc is saying, juice your fruits, juice your vegetables, or you know, if you probably want to get some, but don't do this too much though. Like probably get some like electrolyte powders or so on, just so you can get nutrients as well while you're drinking the water. And probably some like natural flavoring sometimes that can try to get water in, but you know when it comes down to the flavorings and the additives, that's where you kind of need to watch over that. But if you can, like say, vegetables, fruits, juice those, that is a hydration hack right there. And
absolutely, coconut water is my favorite. Okay, coconut water is my favorite. So, if you take lemonade and put a bunch of water in it. Then it's not water, it's just lemonade. That's really what I don't. But hey, it's a start. You know what, I'm a big like champion of saying do what works best for you. Like do like baby steps. What I do is not because I love water, but it takes a long, like I'm so busy in the days. So what I'll do is I'll drink as much water within one time. So like I'll say, okay, I'm going to drink water now, and I'll set the time, and I'll go, I'm going to drink like half of that jug one time. That works for me, right? So throughout the day, I take breaks, and I'll say, I need to drink some water, and I'll drink a bunch. And it will be uncomfortable, and I'll be like, we're drinking more and more and more, because at that point, no, I don't have to constantly think about it. So if that's an issue too. But a lot of us, and there are ways to calculate it, a lot of us need to be drinking. Well, if most people who are my age are not going to be smaller than me. So y'all all need to be drinking at least 3 liters of water or structured water per day.
Yeah.
Okay.
That's a good.
Okay.
Yeah. And a good thing is to get one of those 2.5 liter jugs. I fill it up once. My coworkers always laugh at me. They're like, why I have such a big thing. But
Mm-hmm.
honestly, it helps so much. I just go athlete once and I drink it, and then that's it for the day. And then when I go home, I'll have water here and there as well. So it's like basically just as
Mm-hmm.
3 liters.
Exactly.
So it's like,
Yeah, so you get it in
yeah,
somehow, and you have ways to like make it easier for yourself.
yeah.
And guys, for anyone who's just joining, please see like there is a pinned comment there that has the self-care jingle that we're discussing. So it's just an easy way to remind yourself throughout the day. Put it in your timer, like put it in your alarm, put it in your reminders. Have I had something to eat? Have I had something to drink? Can I name something I feel? And can I name something I think? Yeah, right.
Bars.
Right. Right. I'm
um,
telling you.
Thanks so much for that as well. Yeah, you definitely. Do you have it
Yeah.
somewhere on your page so I can share it when we finish?
Yeah, well, I just came up with it, so
Oh,
I'll
oh,
put it
oh
on my
yeah. Then
page.
as when we finish,
Yeah.
we can share. Before I want us to have at least about 15 minutes
Right.
available for Q&A.
Right, sure, let's go.
I just really want to share something really quickly.
Go
I
ahead.
think you mentioned somewhere along the way that self-care activities such as meditation, yoga, exercise has
Mm-hmm.
marked improvements in your HbA1c score, in your
Mm-hmm.
pressure and so on. I just really want to share this study that I found back when I was on MedRep. I had this study in my knowledge.
Oh.
It's called the DPP, which was the Diabetic Prevention Program, and basically it was a study with about 3,000 people. Half they were all pre-diabetic. Half of them were put on metformin. Now, as a doctor, metformin is the once you have
Mm-hmm.
diabetes, metformin. The other
Mm-hmm.
half through intensive lifestyle changes, which is
Changes.
exercise,
Mm-hmm.
and what you call it, diet changes and so on. And it was found that the people on metformin actually had a lower control of their diabetes, or got out of
Right.
diabetes less than the people that
Mm-hmm.
were under intensive lifestyle changes. So these people, they actually got a control of their pre-diabetic stage, or actually came out of it with just intensive lifestyle change, which in our case,
Awesome.
self-care. So you see that right there's a marked change in trials.
Definitely.
So yeah, it just shows how much power you have in yourself, and I guess that's why the both of us we try so hard to empower our
Right.
followers, and
Yeah.
it's just know that you can have these changes for yourself,
Right.
guys. All right,
Right.
so I think
Exactly.
we can go through the comments now, and if anybody
Right.
wants to drop any more
Yeah.
questions, we can go through and answer them. We're gonna go through
Yeah.
and answer them, the ones that were left throughout the talk. But if you want to add any
Yeah.
more questions, go ahead, use a quick Q&A box, or just use the comments. Let me
Yeah.
scroll
Somebody
up.
did say something. Somebody said,
Yeah.
"Can you give examples of creating positive spaces for your family to care for themselves better, especially concerning busy schedules, lack of good alternatives that can be easily prepared, and then children being picky?" I do have an answer for this one, but I don't know. Do you have anything to say about that?
Examples of creating positive to take care of themselves. Honestly, for me, for that, for what I do for my family, basically, is just empowering myself with knowledge and just knowing
Mm,
what is good for them, and trying to impart that knowledge onto them whenever
yeah.
it is. Because right now I'm not really living with my family, but whenever I go visit them, I always try to cook for them or make meals for them,
Mm,
and then I'll try to have that healthier cooking or healthier lifestyle with them. I'm also always try to talk to them and say you need to be moving a bit more. Now my family is full of like health professionals as well, but so they will
okay.
listen. But sometimes I do have to remind them,
Mm,
just like oh, we need.
to remind us, yeah.
You need to be doing this exercise or that exercise. I will send them some videos as well and be like, hey, probably try this one as an easier one.
Mm,
So you don't have to. And that's another thing I find too, when you push people to do the smaller goals, it helps along the way, because when you do little, every mickle make a muckle. Yeah, so that's
right, yeah.
for me. But definitely just try and empower them with knowledge, empower them with, I guess, just evidence. Hey, do this so you can,
Right.
and
Okay.
make it attainable.
Right, yeah.
Is there anything
I
to
think
add for that? Yeah.
there, there was something, I can't remember the exact thing, but there was something about these 15 minutes are all you need, or 9 minutes. So they said 3 minutes here, 3 minutes here, 3 minutes here. And I don't remember the exact thing, but I think the premise of it was just so important, right? So the idea is when your kids wake up, when they come home from school and right before bed, they need at least 3 minutes. I think that was the premise of it. But let's say 3 to 5 minutes of undivided attention. Now, I obviously suggest that you do so many things with your family that are just like very mindful. So you're paying attention, you're putting down your phone, you're putting down everything else. But if you can dedicate at least 5 minutes to like spending time and paying attention to your children, to your wife, to your husband, to your mom, to whoever you live with, whomever you live with, then that does help to not only increase the connection, but also like is a form of self-care, because you're not only being mindful, but you're also like sharing what we call co-regulating your nervous system, which is extremely important to help to regulate your vagus nerve and reduce your likelihood of chronic illnesses. Okay. There is another thing too. There are different ways that you can do what they call baby yoga. There are, and I'll try and share the pages that are good with like teaching different ways to engage children in deep breathing exercises, in yoga, etc. So there's something that I do with my son to help to regulate his nervous system. So you have this is the flower, okay, and this is the candle. So you smell the flower and you blow the candle. So we do that. So like in the mornings when we wake up, I might take him outside to get the sun on his face, and I'll ask him to name 3 things that he's grateful for. I'll list 3 things I'm grateful for, and then we'll smell the flower and blow the candle. Now my son is 4 and he could definitely do this. He's been doing this since he was 3. Smell the flower and you blow the candle. It's a big birthday candle, and they love doing that because it's so much fun, right? So that's one of the ways that you can help your small children to regulate their nervous system. Not only gratitude, but nervous system regulation from such an early age, so that when they're older, they do this naturally. They begin to just naturally, if they're feeling stressed out, you can pull it out and you say, okay, it's time to smell the flower now. And they'll start doing that on their own, or helping you to do the same when you're stressed out. So that's just a beautiful way to include your kids and your family in that. Yeah, I'm so glad you're still here and you got that help. Yeah, because it's really fun.
Thank you so much for that question. It was very insightful.
Yeah, it was a good question.
Another one. All right. So in the question and answer box, there is, how do we stay consistent with self-care?
Yeah, I don't even know where that box is, but
how do you
how do you stay consistent
with self-care?
Listen, I have a few. Can you still hear me? My AirPod died.
I can hear you. Yeah, I can hear you. Can you hear me?
Yes.
Okay. Yeah, we can still hear you.
So there are a few ways to stay consistent with self-care, okay? So not only can you set the reminder in your phone, have I had something to eat? Have I had something to drink? Can I name something I feel and something I think? Because what you want to know is, how is your body responding to the stimulus that it's getting, right? So if you're thinking about your boyfriend or your girlfriend and you notice that your body's tensing up, it might be a sign that that person is becoming a stressor in your life instead of contributing to the ease. Self-care jingle is really important. I have this document on my page. I'm gonna double check that it is there in my link. It's called Feel Better Bingo. Okay. These are random things that you can use to feel better instantly, right? The point is to get bingo all the way across or down, or you know how to play bingo, right? So for example, music or a song, you get that free one, you eat 3 fruits, and then you get 10 minutes of sun. So it's really, really quick and easy. This is something you can download and you can use it on your phone so that you can use it over and over again with like a little marker. So I just use this randomly. So I'll say, okay, well, I'm not feeling my best today. I can color or paint. I can walk outside for 15 minutes. I can help somebody. So there are random things. And this is something that can, self-care bingo, it is fun. So you can print this off and put this on your fridge or wherever. And I'm also coming out with like a whole workbook, but it's not out yet. But y'all getting a sneak peek.
Oh,
Y'all getting a
speak
sneak peek.
everybody.
Hold on. I'm popping out a sneak peek. Okay. Because that's a good question. Where is it? So I'm creating this thing called a life builder, right? Which is gonna include lots of different self-care stuff. So you can easily download this. You can use it on your phone, whatever. This is gonna talk about your values, what you want your life to not just look like, but feel like. And you're gonna build your life based on what you want that to feel like. But then that also includes a daily habit tracker. So there are different types. Okay, this is the girly one. Don't worry, guys, we got you. Of course, I'm not gonna leave out the men. I won't be the one to leave out the men. So it's like we have one that's like more green, more. So this one says fill my